How to deal with clinical depression. Clinical depression is not a case of the blues, or just being sad sometimes. Clinical depression means you are depressed at the clinical level, meaning you have a mental health diagnosis. There are quite a few diagnoses that include clinical depressive symptoms, including major depressive disorder, disruptive mood dysregulation disorder, persistent depressive disorder, dysthymia, and premenstrual dysphoric disorder. There are also depressive disorders that are caused by substance use, medication, or a medical condition. Whichever depressive disorder you have, you can successfully deal with your depressive symptoms by getting support, using coping strategies, and changing depressive thinking. 1. Keep yourself safe if you have thoughts of harming yourself. If you are currently having thoughts of harming yourself in some way or of killing yourself, you need to get support immediately. If you ever feel suicidal or have an intent to harm yourself and don't trust your impulse control, get outside support right now. Call your local emergency number, such as 911. Go to the nearest emergency room with an explanation of how you feel. Tell them that you are feeling suicidal. 2. Talk to a therapist. If you choose to enlist the help of a therapist, be sure to select one that is qualified to work with depressed people, and with whom you feel compatible. The right therapist can't solve all your problems instantly, but she can help you learn to help yourself, refer you to a psychiatrist if needed, for medication, and provide support through tough times. 3. Consider getting medication. Medications such as antidepressant SSRIs can be helpful in treating severe depression. Find out if your therapist thinks medication would help you. Ask for the names of psychiatrists that the therapist knows have been helpful to people with a similar history. Before thinking that medications is the best way to help one's depression, please remember that it can take months to years to find the right medication for you. However, it does not need to be this way. Pharmacogenetics testing is a type of genetic test that in some instances can predict how a person will respond to specific medications. This is also known as a PGX test. This test is the first step to precision medicine, and removing the trial and error method that takes months/years. After taking the test, one will receive a report that identifies one's ability to metabolize specific medications, such as depression medications. Starting your treatment with the correct medication is called precision medicine, and removing the trial and error method ensures that one will not have any adverse side effects or drug reactions should one follow the readings in their PGX test report. 4. Seek support from family. Social support is one of the most helpful resources when dealing with depression. Support can assist you in feeling that you are valued, loved, and that there are individuals who are willing to help and care for you. Depression is a hereditary mental health issue. Look around your biological family. Are there other depressed people? Watch them and see what they do that seems to work. If some individuals in your family are more supportive than others, seek help from those individuals first. If you don't feel comfortable seeking support from any close family member, parent, sibling, look outside your nuclear family for support from grandparents, aunts, uncles, and cousins. If you still find a lack of support, venture outside of your family to close friends. If your therapist is the only person you can currently count on for support, that's okay. Your therapist may be able to connect you with group therapy, which can provide social support if you don't have friends or family you can count on. 5. Share your feelings with others. Emotional support is a common coping resource for dealing with depression. This is because it helps to release your emotions in the company of others instead of bottling them up, which can lead to an outburst or a breakdown. Talk to your friends. If you feel even worse than usual, having a friend to listen and support you, even by just being there, can save your life. Sometimes it is hard to get started when you are depressed, and there is no shame in having a friend get the ball rolling. Crying with a friend or family member can be emotionally cathartic. If you are ready to be cheered up, ask your friends to do something fun with you. 6. Cultivate healthy relationships. Studies have found that the quality of your relationships with partners, families, and friends is a significant risk factor in major depression. People in unhealthy relationships or lacking support have more than double the risk of depression than those with healthy relationships. Identifying and eliminating unhealthy relationships may help with your depression. Healthy relationships are respectful, trusting, collaborative, and accepting. They involve physical affection, open communication, and fairness. Unhealthy relationships are typically intimidating, humiliating, threatening, dominating, judging, and blaming. They are also associated with abuse, verbal, physical, sexual, and possessiveness. Take an inventory of your current friendships and relationships. Are there individuals who bring you down or criticize you? Perhaps these individuals do more harm than good. Consider if you need to create distance in unhealthy relationships, or build new ones. 7. Educate yourself. A good place to start in any quest to fix a problem is through research and education. Knowledge is power, and knowing what is affecting your depression is half the battle. Informational support can help depressed individuals cope with difficult situations. Psychoeducation is the specific term for becoming educated about your particular disorder. You can ask your therapist for psychoeducation about your disorder and work it into your treatment plan. Get books, research articles, watch documentaries, and conduct internet searches to learn more about your specific condition. 8. Set goals. Goal setting is an integral component of any therapy to reduce symptoms of depression. In order to achieve a reduction in depression, you must have a plan. Ask yourself what you want to achieve in terms of dealing with your clinical depression. How do you want to deal your depression? Do you want it to be less severe? Do you want to learn new coping strategies? Be specific and set time-limited, 1 week, 1 month, 6 months, and attainable goals. For example, completely eradicating your depression in 1 month may be an unrealistic goal. However, reducing your depression on a scale of 1 to 10, 10 being most depressed, and 1 not at all depressed, from 9 to 7 may be more attainable. Make a plan to reduce your depression. Use the coping strategies listed here as guidelines for creating specific goals. For example, one goal could be to conduct research about your mood disorder at least once per week. Evaluate whether your plan is working. Change the plan if you need to in order to include new strategies that you haven't yet tried. 9. Increase pleasurable activities that work for you. How one chooses to cope with depression will rely on specific stressors, culture, personal resources, and unique social situation. Some examples of good activities are reading, watching movies, writing in a journal or writing short stories, painting, sculpting, playing with an animal, cooking, playing music, sewing, and knitting. Schedule these pleasurable activities into your daily routine. Spiritual and religious practices, if you are so inclined, have been shown to reduce depression, especially in the elderly. 10. Work to solve the problem. Sometimes there are specific life events and stressful situations that contribute or increase depression. Using problem solving as a coping resource during these times can help reduce depression. Focus on what you can control about the situation, your own reactions or thoughts about it, rather than worrying about things you can't control, such as what other people do. Sometimes interpersonal conflict can increase depression. Use conflict resolution if you have issues with other people. For example, discuss your feelings in an open but non-aggressive way. Use assertiveness by using I statements, such as, I feel sad when you forget to call me back. Focus only on what you can control. Refocus on planning and problem-solving things that are changeable, instead of thinking too much about what others are doing wrong or what is happening in your environment, traffic, loud neighbors, etc. 11. Exercise. More physical activity is strongly associated with reduced levels of depression. Exercise can even help depression in spite of medical problems and negative life events. Do any exercise you can, including walking, running, biking, using an elliptical, hiking, or weightlifting. Try fun exercises you may not have tried yet, such as Zumba, dance aerobics, yoga, Pilates, and kayaking. 12. Ground yourself. Grounding exercises, or distraction techniques, are useful if you need to temporarily distract yourself from emotional pain. Grounding enables you to take a break from feeling depressed and ruminating and focus on something else. Try a mental grounding technique of naming all of the states, colors, or animals you can think of, from A to Z. Engage in a physical grounding exercise such as running cold water over your hands, taking a bubble bath, or petting an animal. There are many other grounding exercises you can research online. 13. Accept sadness and depressed moods. Depressed individuals may be less likely to think that situations require their acceptance. However, many situations can be dealt with more easily by simply accepting them. For example, when you feel a negative emotion, such as depressed mood or sadness, accepting this emotion as normal and okay can help you cope with it healthfully. Sometimes not accepting negative emotions creates a block in your ability to process the emotion so that it naturally subsides. By not allowing yourself to process the emotion, you may experience longer periods of sadness or a depressed mood. Try working on acceptance by saying or thinking to yourself, "I accept that I am depressed. It hurts, but my feeling is giving me valuable information that something needs to change. I'm going to find out what needs to happen for me to feel better." If you want to watch more videos like this, please subscribe to this channel. Thank you for watching.